Good afternoon, folks. Bob Hodem here with the Alternative Board Miami Valley and my client, Greg Robinson, with Healthcare Claim Solutions. How are you doing today, Greg?
I'm doing fine.
I shake your hand, but that's not appropriate right now.
There you go.
Right. So we've been filming a series of business owner Corona Chronicles, and I wanted to talk with Greg a little bit about today about how his business was through this entire COVID-19 scenario.
Sure.
So for the folks, Greg, to start, describe your business.
We have a service organization that provides reimbursement-related and billing services to physician groups. We do that from offices here in Dayton, Ohio, Indianapolis, Indiana, to customers spread throughout the Midwest.
Okay. How long have you been in business?
We've been in business over 20 years.
Oh, cool. Okay, great. So describe for me kind of how your business was in terms of volume and activity pre-COVID, we'll say January or February.
Well, we were seeing typically a crescendo in business that happens for our customers during the winter months, and we're managing to that. And then, of course, saw, as everybody else did, a dramatic change both in business operations as well as in our customer operations.
Okay. So March, I think it was the 17th, we got locked down here in the state of Ohio. So how did COVID impact you during that period of time?
Well, interestingly, we had a variety of questions from customers coming in. We had customers who were concerned about our liquidity. Would we be able to survive?
Oh, wow.
We had customers who were calling us to say, hey, we're laying off all of our staff and shutting down our operation until the turnaround. And then we had some customers that were coming to us and saying, hey, can you help us manage through this? Because we don't know exactly what our next step should be.
Wow.
Yeah.
So revenue-wise, it probably impacted you, right?
It did. Our revenues went down by about 20% a month early on and stayed consistently lower during that. We see some recovery here in the third quarter, I think.
So a lot of the non-essential surgeries that were kind of laid off or not done were pushed back probably impacted you from the billing.
Well, they will. Anybody who was a proceduralist, or providers who do procedures, which would be surgeons or other people who do tests or run studies on patients, all were shut down. Mm-hmm. And that's the first time in my professional career that we've seen something like that.
Yeah.
First time in most of our customers' professional careers have seen it.
Yeah, well, yeah, I certainly understand that with the number of the clients I have. So how did that impact or change your business, if you will?
We lost productivity immediately. In the third week of March, there was so much messaging coming from both the government and all kinds of other social media channels that were creating havoc among our staff because they didn't know where their schools were open. They didn't know if their children were going to be educated. They didn't know if they had child care. They didn't know if their spouse was going to be working. They didn't know all of these things they didn't know about. So in that immediate aftermath, if you will, of the announcement to close things, our first work was with our employees.
Mm-hmm. Yeah, I can see that, I would guess. Now, did you send some employees remote?
We made after we kind of assessed what the condition of our customers was and the condition of our employees, we endeavored to make it possible so that every employee could conceivably work remotely. Because we didn't know more than anyone else what we might be forced to do as a business.
Right.
Thankfully, we didn't have to have that, but we did have several employees who chose to work remotely for a period of time.
Right, okay. And that probably negatively impacted productivity as well?
It did. We tracked productivity and found, our remote folks were about 20% less productive when they were at home than when they are in the office. You could take the position that over time that productivity would have picked up. I don't know. Most of those people, actually all of those people, returned to the office.
Oh, okay. Yeah.
And so we don't have a real good pre-post kind of consideration of that.
Sure.
But as the initial concern about transmission of the COVID virus kind of came off, then people got more comfortable returning to the office.
Okay. Well, other than just remote working, were there any other things that you changed in your business to kind of get you through this, if you will?
Obviously, we spent more time communicating with our employees we spent more time communicating with our customers, and the customers who were slower were reaching out to us more.
Okay.
Just with various questions. As with everybody, you know, the cleaning supplies and how frequency and duration and timing and all the things that are associated with keeping your office environment clean and people feeling comfortable in it. You know, we changed all of those metrics, really just with the idea of making sure that the staff felt good about their environment.
So if you think about where you're at in January and where we're at now with filming this in the first part of July, a couple of things that you change, a couple of things that you've done differently that you might point out to other business owners they would consider?
We've tried to really stay ahead of the staff, if you will, by going to resources within the government to determine what the best practices are for distancing or cleaning, or you know, if they have some ideas about mandates. Those we found it better to be able to have a reference document and say, here's what, you know, the Department of Health is saying. So that's something that's very important to us. And we've tried to deliberately engage our employees and listen to them.
Okay.
Not that we're able to dissuade somebody's fears necessarily, but to let them know that we are concerned about our employees.
Right.
And we want our employees to do well, whether it's on our premises or whether they're at home.
Okay.
And we'll support whatever that takes.
So it's communication and also kind of guidance, if you will, listening.
And you would recall, we also opened up an on-site, we allowed people who lost their school or after-school daycare for children, we opened service on-site so that we would have supervised education and service available for those kids.
So you basically opened up an internal daycare for a period of time.
We wouldn't call it that, but yeah.
Okay.
There's some licensing things.
Oh, okay.
But, you know, the moms and dads are 40 feet away.
Yeah.
But we had skilled, qualified staff there, and I think that was helpful as well.
Yeah. Probably put the employees at ease, if you will.
That was the idea, sure.
Great. Well, it sounds like you've transitioned reasonably well. Any final thoughts that you might have for the business owners that might be viewing this narrative?
You know, interestingly, we have found we are impacted negatively. We've seen some folks impacted positively. And then, you know, people in the middle whose revenues may be a little choppier, but, you know, haven't really gone substantively lower or substantively higher.
Right.
The things that we really paid more attention to are being more deliberate about management practices, talking with the administrative staff, and really trying to think through how is this going to look 90 days from now? How is this going to look in 6 months?
Right.
What are the resources that we may need to be able to achieve these things?
Right.
Yeah.
I'm hearing that from a number of the clients that I work with in that regard, just being more deliberate about their management and so forth.
Yeah.
Precisely. Well, thank you very much, Greg. We appreciate you taking the time today. It's Greg Robinson, owner of Healthcare Claims Solutions over here in Dayton. And I'm Bob Hodem, owner of the Alternative Board in Miami Valley. We offer prescriptions for perplexed private business owners.